Now, for more on the state of the pandemic and vaccines, let's bring in Dr. George C. Benjamin, the Executive Director of the American Public Health Association. Dr. Benjamin, thank you so much for taking time to chat with this important story. I'm curious to get your take, if you will, away from Pfizer's earnings report and some of the information that John brought up, the fact that it is able to take public money but doesn't have to share information about its vaccines.
Well, Sean, thank you very much for allowing me to comment. You know, obviously, they've got a great new bivalent vaccine, and more and more of us are going to be using that vaccine as we go through this next COVID pandemic. Obviously, they're a private company, and we hope that they'll be more transparent as they go forward in the future. But, you know, their vaccines don't usually make a lot of money, but so far, COVID is doing quite well.
Yeah. Sadly, it's kind of odd the way that turned out. Now, successive COVID drugs. What is next on this front? Long COVID treatments. Has the company gone as far as it can in preventing and treating COVID and also dealing with the brain fog and all the other ills that come with this long COVID?
No, we've got a lot more to learn about how to deal with long COVID. We're still trying to really get a good definition of it. And then what would be the role of vaccines? What's the role of drugs like Paxlovid to try to stem the tide of that very serious disease? But there are a lot of research protocols going on right now to try to better understand this, and we should anticipate more therapeutics and maybe in some cases using these drugs a little differently to try to address long COVID.
Interesting. Now, is the same thing we're seeing with Moderna, Johnson & Johnson, and others who were part of the COVID vaccine? Are we seeing that play out the same as we see for Pfizer?
I think, Pfizer's obviously been a bigger vaccine company, but I do anticipate over time, many of these other companies will probably to expand into other therapeutics as well, particularly things like monoclonal antibodies.
And go a little more into detail about that, if you can. Contrast and compare these various three companies and really how important they have been on the front line from not making COVID any worse than it really was in the United States.
Well, what I can tell you is that the 20 years of previous research into mRNA vaccines, all three of these companies were able to capitalize on that very quickly and quite frankly create just an amazing scientific achievement. And there's just more and more they're going to learn. We're learning each and every day more and more about how our immune systems function. And this research that we're doing right now is just amazing.
What kind of frustrations do you personally have with people who say, I'm not going to take the vaccine, I don't need it, I don't believe in it? That was a real problem in the U.S.
It was a problem globally. Lots of people who had suspicions about the speed in which the vaccine was created and a lot of misinformation. But, I practiced clinical medicine the first, 20 years of my career. And one of the things that I learned is just to simply be patient with patients, to simply talk with them about what you think their best advice you're going to give them. And then eventually they usually come around.
In the spirit of full disclosure, I was first at the line to get these vaccines. I'm a big believer. But talk about Pfizer's progress on the RSV drug. We heard John Terrett talk about. It's a respiratory virus, and as he mentioned, it treats the infant in the womb. Explain that to me.
Yeah, well, it's a RSV virus, a respiratory syncytial virus, has been around a long time, and it tends to impact the very old and the very young, basically people whose immune systems haven't quite fully developed or whose immune systems are fading away. And one of the things that they've looked at with this new vaccine is if they can give it to pregnant women, it will protect children very early in life. So, under 6 months of age, if it's given to the mother. And so there's been a study where they've given to the mother, and it appears to protect children from RSV virus who are very, very young. And they've also had a study, by the way, looking at the elderly. And in the elderly, that vaccine seems to work quite well as well.
Good information. Now, what other vaccines do you know of that Pfizer is working on for release soon?
Well, I don't know of all their vaccines per se, but they have over 110 different products they're working on in various research enterprise. So I think stay tuned. And I also think that the mRNA vaccine studies that we've done, I think we're going to see some additional work on mRNA vaccines, not just for infectious diseases, but also for cancer.
Yeah, I like that. Stay tuned because winter is coming, as they say, and time to keep that guard up. Thank you so much, Doctor. We appreciate it.